Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the Healthy Living edition of KUAM News Extra. Tonight we are talking about a subject that most people are embarrassed to talk about and most people will experience, though, at some point in their lifetime. In fact, approximately 2% of the population is affected by it. We're talking about constipation and bowel problems. Constipation is when bowel movements become difficult or less frequent. It can also be very painful and frustrating, and actually it affects more women and the elderly. Here to tell us more about this topic and who isn't afraid to talk about the subject is Express Care's Dr. Jitka Lom. Thanks, Doc. And the whole reason why we're talking about constipation for our viewers out there is because you've noticed an increase in customers coming in or patients coming in who are experiencing this, right?
It's really true. Yeah, I think partly due to our diet and partly just not being aware. Many people will not even be aware of what they should be having as far as a bowel movement. I always say you should take out the trash every day, and it doesn't need to come out. And the problems can range from tummy aches and gassy feelings and nausea, but also getting headaches and just feeling generally sluggish and unwell, and just having a proper clean out will usually help that.
Okay, so I know we are during the dinner hour, so we won't get too in detail, but so people should have it basically should have a bowel movement once a day. Yeah. Is it normal maybe not to have it every day? Or?
Yeah, the definition of constipation is less than 3 bowel movements per week, and also having a difficult time straining or having very hard lumpy stools that are hard to pass, and there can even be blood with that. So that's kind of the definition, but what we're aiming for is a nice, easy, soft stool every day, preferably in the morning after your breakfast, and spending less than 2 minutes on the toilet.
All right. Now, what can somebody do to alleviate constipation?
Okay, assuming that they're very healthy, because there are some medical problems that will cause constipation, one of them being bowel obstruction if you have an intestinal blockage inside. But other things that may cause it are diabetes, thyroid problems, calcium problems, or even medication that you're taking. But assuming that you're very healthy, the thing to do is clean out first, take maybe a laxative to just eliminate everything, and then go back to a very healthy diet. And for that you need a lot of fiber in your food, so at least 5 servings of the fruits and vegetables per day, at least your 8 glasses of water per day to keep things soft and moving, and lots of exercise to help the bowels move also. So those 3 things: diet, exercise, and water.
They seem to be brought up in just about every topic that we talk about. Now, can it be a result of eating bad food? You're talking about eating a lot of fiber, fruits and vegetables, especially in the local diet that's just pretty much meat and rice. So we kind of forget about the vegetables sometimes.
Yeah, oftentimes. And rice is really quite constipating. You see, your bowels your intestines are muscles, and they are squeezing, moving your food along, extracting from it all the good things and leaving the waste behind. And that muscle needs something to grab onto. So if you're eating Twinkies and chips, there really isn't a whole lot of fiber in that for the guts to grab onto. Whereas if you're eating food, celery, carrots, broccoli, all those foods that are water rich and they also have a lot of fiber in them, then there will be more water in the intestinal tract, and they will also be able to get a grip on things and move them along.
Okay. Now, what diet? So we went through the dietary changes. Now, what happens if you don't take care of it? I was reading up that you can have. There's something called chronic constipation.
Quite serious problems, really. So the common ones would be, of course, a discomfort in your abdomen. But besides that, the most extreme would be impaction, where they're actually stuck. Okay, and then people have to go in there and clean you out. Perforation means that there's just so much pressure and stool in there that there's actually a rupture. Okay, those are extreme examples, but then we can have something very common, hemorrhoids, okay, or something called diverticulosis. So normally your intestines are a nice smooth pipe, but if there's so much pressure all the time and so much stool that they can't cope with it, your intestines will get little pockets. So instead of being a nice smooth tube, it'll be sort of a bumpy tube, and food can get stuck in those little pockets and give you an infection called diverticulitis. And this is a very common problem in elderly people that can also result in surgeries and antibiotics and all kinds of things, which you could have prevented by eating properly all those years of your life.
Good to know. So are taking laxatives safe, and if so, for how long? Because you did mention maybe you should do it once to kind of cleanse everything out.
It's just for how many times a year? Let's say no more than 4 or 5 times a year you should be taking a laxative. The rest of the time you should be relying on your diet and exercise and water. Overuse of laxatives can result in constipation because your body basically stops responding to them.
Okay, any natural remedies rather than over-the-counter stuff?
Yes, you can drink prune juice. That'll work for almost anybody. Papaya, for some people coffee will do it, or milk. Other people get constipated from milk. But prune juice is incredibly healthy and easy to tolerate, even for your children.
Okay, now I want to throw this question in before we throw it a break, but we've all seen those Jamie Lee Curtis Activia commercials. Does it actually work, and what is the ingredient, magic ingredient in yogurt?
Well, all yogurt, not just Activia, has probiotics in them. These are healthy bacteria that work in your intestines and maybe speed up the transit time, meaning your food travels more quickly, but doesn't have a whole lot of fiber. So instead, and has a lot of sugar. So instead, go ahead and get some Metamucil, which is over the counter also. It's a powder. You can mix it with orange juice or your water. And you can get sugar-free for those who are diabetic, and that way you'll get enough fiber and lots of water, and I think it'll be quite a bit cheaper.
And then what about just Psyllium? I think I've seen Psyllium tablets. Can you just take that as well?
You can also take those, but again with a lot of water, because otherwise they'll plug you up.
It can have opposite effects. So good to know. We will pick up our discussion on this topic when Healthy Living returns. Stay with us.